Hello everyone, this is a NACOSCE station for shoulder pain for physical examination. Please keep in mind that this is for educational purpose only for those who are preparing for the NACOSCE examination. I hope that this video will help you to do better and achieve a better score. Although keep in mind that you need to read more about taking history examination on shoulder pain. Let's start. So the first step is to think how you will use the 2 minutes at the door, how to structure that time. First, the most important is to understand the task. You need to read the instructions carefully and see whether it is a physical exam or history taken or both, and then how much time do you have. Is it only 8 minutes per question or only 11 minutes full station only for physical exam, which can be case for shoulder pain. Then you need to keep in mind that shoulder has 3 joint and 1 artificial cartilage, and maybe make a plan which pathology you will be thinking about regarding to the anatomical structure, and then which test you will be perform. It's good to keep in mind some abbreviations, like for musculoskeletal system we can use some approach like look, move, feel, inspection, range of motion and palpation, and then special tests and neurovascular exam, as you know. Next step, knock on the door, sanitize your hands, greet everyone in the room and ask for vitals. This is very important not to forget where to start it. Then start with simple questions, what you have for taking history, but if it's physical exam, just ask, don't forget to ask an approval from the patient for performing a physical exam, and don't dive in too much into history taking, just few questions of it. Then use the abbreviation. So first you need to inspect, and don't forget to narrate everything what you are about to do and what are you doing. So inspect for swelling, erythema, bruising, atrophy, deformity, asymmetry, and use SIDS mnemonic. Check for active and passive range of motion. Perform the active range of motion first. If there is no pain, you can comment on passive range of motion, there is no need in it. But if there is pain, you need to perform passive range of motion. Of course, talking with patient about the severity of the pain. And guide the patient what to do, step by step. Look for any pain, listen for clicks or crepitus, observe any limitation and movement. Look at the face of the patient, do not look at the examiner. The patient is the most important here, and show your attitude, present that you care, be empathetic. During the whole station, do not forget to check with patient whether they're comfortable or not, whether they need something or not. Do not overdo it, but still once or twice confirm with that the patient are not in pain or comfortable to bear it, to stay with you. This will show your empathetic approach. Then be aware about time. If there's a shoulder pain, you will need to perform a neurovascular exam at the end, so keep time for that. And then after the palpation, you need to perform special tests. Only for pathology. So if you have differential diagnosis, perform special tests only for those things which you are assuming might be the issue. Do not perform all the tests, and do not perform only for one pathology. So just be mindful about that, and ask the patient to reflect on everything what you're doing, and explain everything ahead what you're doing to them. Last tips. During the station, pay attention, do not stand between the patient and examiner. Let examiner see everything what is happening between you and the patient. Communication, examination, everything. Keep in mind, do not hide that view from the examiner. The second thing is, this is a shoulder pain station, but you have another shoulder, you need to at least mention that you will be examining the healthy shoulder, and then you need to check joint above and below. Those things need to be mentioned, and do not forget to narrate everything you do. This is very important for this exam, and you can make a conclusion if you still have time about the patient, like in this slide. If you don't have time, that's okay. But what is very important is to greet the patient and make sure to wash your hands before you leave the station. Also, while you are preparing for the station, aim for the less amount of minutes of time, because in the real life, in the real exam situation, time goes quicker. So if you're preparing for the 11 minutes shoulder examination station, make it in maybe 9.5 or 10 minutes. And if you prepare for 8-minute station, make it for 7 minutes. So you will be fine on the exam day. I wish you all good luck with your NACOSCE. Bye!